5 years ago, the COVID pandemic went full throttle across much of the world. In March and April of 2020, from China to Italy to the U.S., the numbers of infected people skyrocketed. So did the number of deaths. The origin of the virus was debated, most likely jumping from an animal in the wild to humans. Well, tonight, new revelations. German intelligence knew all along the coronavirus that triggered a pandemic and stopped the world was released from a Chinese lab by accident. I'm Brent, Goff in Berlin. This is The Day.
It was an indescribably painful time.
My mother died within 5 days. She was buried in a bag because the undertakers weren't allowed to touch her.
Being isolating at home, we forgot how to interact with people. We're being confined, so we were actually forgetting how to be human.
I remember basically living at the hospital.
We weren't able to say goodbye to them in hospital. We weren't able to come together as a family.
I remember many of us not stopping crying for at least 2 to 3 years.
Also coming up, imagine Turkey helping to ensure the defense of Europe. With transatlantic ties loosening, Europeans are now looking not west, but east for military support.
Turkey has definitely become more important for Europe now, in the wake of sort of a new White House, a new Trump administration that is telling Europeans loud and clear that they're on their own.
To our viewers watching on PBS in the United States and to all of you around the world, welcome. We begin the day remembering the first days of a pandemic. It was 5 years ago when the World Health Organization declared the coronavirus pandemic. 37 million lives were lost. The U.S. was hardest hit, followed by India and Brazil. And people still die from COVID-19, and people still speculate about the genesis of the virus and who may have been to blame for the pandemic. We're going to have more on that in just a moment. But first, here's a look back when the world began to shut down.
When the first reports emerged of an unknown disease spreading among people in China, few could imagine the scale of the global disruption that would soon follow. Officially, the outbreak was linked to a live animal market in the Chinese city of Wuhan. The illness, with its flu-like symptoms, was capable of causing severe breathing difficulties that proved fatal for many people. It was identified as a coronavirus and given the name COVID-19. At first, health officials struggled with how to treat the disease. And it was highly contagious, spreading quickly from beyond China to Europe and North America. Within weeks, some regions with high infection rates began limiting residents' movements. Others were criticized for being too slow to respond. In March 2020, the World Health Organization declared a global emergency.
We're deeply concerned both by the alarming levels of spread and severity and by the alarming levels of inaction. We have therefore made the assessment that COVID-19 can be characterized as a pandemic.
In northern Italy, the epicenter of Europe's first hotspot outbreak, pictures of military vehicles transporting bodies to crematoriums shocked the world and underscored the virus's deadly potential. In the months that followed, normal life was completely upended. As more lockdowns were declared, schools and businesses closed, and travel came to a standstill. Hospitals filled up, and so did the cemeteries. People were advised to wear face masks, and in many places they became mandatory, as did testing for certain activities. From the workplace to family life, online video calls replaced in-person meetings. In the meantime, scientists raced to develop vaccines, with the first becoming available just a year later. The vaccines were credited with reducing the severity of COVID cases, though the virus was never eradicated. As more people became immune and treatment improved, governments determined that COVID-19 no longer posed a public health emergency, and restrictions were gradually lifted.
And of course, the pandemic, it was the subject of many editions of this program right here, The Day. Here's a brief look back at how we covered that historic event 5 years ago. We begin the day with the dead in Italy.
3,405 people that have died with COVID-19 infection in them.
Are working round the clock, countless hours to fight this incredible situation.
Today, Germany closed its borders with 5 of its neighbors.
A temporary restriction on non-essential travel to the European Union.
This pandemic could easily morph into a global recession that could be worse than the Great Depression of the 1930s.
Absolutely.
And from Madrid to New York to Berlin, stores, shops, bars, and restaurants were closed. The day Italy overtook China.
They're just shocking and incredibly heartbreaking.
As the country with the most deaths from the coronavirus. Quarantined patients dying alone, the front line between humans and a virus.
We do not know how long this pandemic will last.
Memories from 5 years ago, and I want to pull in now my colleague, journalist Seema Gupta, who you just saw in that clip. She joins me from Rome. And Dr. William Schaffner, professor of preventive medicine at Vanderbilt University in Nashville, Tennessee, who was a familiar face to our viewers all through the pandemic. To both of you, it's good to see you again. And Seema, let me start with you. You know, watching our coverage from 5 years ago, the fear of that moment, it's almost resurrected. What goes through your mind watching that clip of your reporting from those fearful days 5 years ago?
Well, I think it's how you put it. It's just the sheer fear that everyone had. Nobody knew what was causing this. I mean, we were reading about it. We were finding out in real time. So in the meantime, everybody was just terrified. And I remember the feeling of how we knew that the lockdowns had started up north, but it seemed everyone thought, well, it's contained up north. It's not going to come here. And then the national lockdown. So people were really fearful. They didn't know how things were going to work. At the same time, there was an element of solidarity as well, I think, because solidarity with the healthcare workers, understanding that those were the people on the front line. But I think one of the images that really struck everyone was what was happening in Bergamo up north, when the morgue was just overflowing with the number of bodies that army trucks had to be called in to bring those coffins out of the city. So those kinds of images, those kinds of impressions and emotions, I think, are still quite vivid 5 years on.
Yeah, they certainly stayed with us. Dr. Schaffner, you were with us from the very beginning of this pandemic, walking with us, helping us to understand. What stands out to you most when you think back to March and April of 2020?
Well, I think the vivid pictures that Seema mentioned certainly were replicated around the world, and indeed close to that in my own neighborhood. I'm so glad those days are behind us for sure. But the other thing in reflection that I think about is how confused the messaging was to the general public. Yes, in the beginning, we didn't have all the information we needed, but over time, still, at least in the United States, the public health messaging to the average person and indeed to the medical profession was not as clear, repeated, and acceptable as it should have been.
I'm going to pick up on that in just a second, Dr. Schaffner, but let me ask you, we hear that another pandemic is inevitable. Will our public health institutions be better prepared next time?
Well, I think through experience, of course, we are. But at least in the United States, you know, we have very short memories. And I am cautious, although I'm an optimist. I have to be cautious because I think it's possible for us to make some of the errors we made before. One of them I just mentioned had to be with communication. The other was, at least in the United States, to have the individual states actually do their own thing as regards the approach to COVID, when what was really needed was a national response when everybody not doing exactly the same thing at the same time, but all playing, if you will, from the same sheet of music,
Sure.
from the same general plan.
Seema, what does it look like in Italy now? Could Italy handle being ground zero of another pandemic?
Well, that's the question a lot of journalists have been asking as we approach this anniversary. I mean, there has been this idea of creating a new pandemic plan, but that plan has yet to be approved. It's been brought forward to the different regions for approval. And in the plan, the government that is currently in place, the government of Prime Minister Giorgia Meloni and her Brothers of Italy party, they were in the opposition at the time of the pandemic. And they were very much against all the restrictions that were placed on personal liberties. So in this plan now, they're saying that there can be no administrative act or decree to limit people's personal liberty unless in an extreme situation. So really some controls there. There's also a frustration that perhaps there are not enough beds in intensive care units. They asked for an increase, but we haven't reached the mark that's required. And doctors, healthcare workers have gone on strike, saying that they're still not getting the pay that they deserve or the staff requirements that they need in order to carry out their work.
Yeah, we hear that here in Germany as well, Seema. You know, there are reports coming out that Germany's intelligence agency, the BND, knew in 2020 that the coronavirus originated in a lab in China and that it was released by accident. I think it was 90% certainty already in 2020. Dr. Schaffner, let me ask you, the public apparently was being kept in the dark here. Why not full disclosure? What are your thoughts when you hear that?
Well, I think the origin of the pandemic is going to be disputed for many years. I doubt that we will have a definitive answer. There are people and institutions in the United States that, similar to what you've just said, Brent, really implicate the laboratory in Wuhan. And yet the majority of infectious disease people and molecular virologists think that this was a natural event, a species jumping event where the virus came from bats and pangolins and entered the human population and was able to spread. So there still is this dispute. I think it will be ongoing for some time.
Yeah, and it would have probably made no difference in how we combated the virus, but it certainly impacted the trust that the public has in public institutions. Seema, what condition is that trust in today in Italy?
I think in Italy, there is still mistrust as to how much information they actually got. In the same way, the feeling, as Dr. Schaffner mentioned, I mean, people will argue as to the origins of that pandemic. And if another one comes along, are they going to trust in the state authorities and the institutions to be able to bring the care to them? There are pockets in society who were frustrated and angry with the way things were handled. In fact, court cases were brought against the former Prime Minister and the former Health Minister on this issue. They felt that not enough was being done. The case was eventually thrown out because the judges deemed that the politicians simply did what was best to their knowledge at that point in time. But clearly frustration on many ends as to how much information they were getting and how true it was.
And Dr. Schaffner, I'm going to give the final question to you. The post-pandemic world is a world full of lonely souls. We've been told that lockdowns did more harm than good. Is there a prescription to heal the loneliness epidemic that rose from the coronavirus pandemic?
Well, I think we're all still working on that, Brent. People are gradually coming back to work and going back to religious services and sporting events and things such as that here in the United States. So we're working on that. But that was clearly a consequence of our sustained social isolation. And one of the things that we'll have to think about in a future pandemic is if social isolation is necessary, and it may well be, how can we minimize that social isolation so we don't get into this loneliness epidemic which followed COVID?
Yeah, let's hope we don't have to deal with those questions for a very, very long time. Dr. William Schaffner in Nashville, Tennessee, and Seema Gupta in Rome, Italy. To both of you, thank you. Good seeing you. Good to see you both healthy. Thank you.